Hi, Kohei Suga with Fun Physio. Today, I will talk about dizziness, which is so many people suffering from. Dizziness is an intolerable symptom, but if you were fall into the specific types of groups, physical therapy would be helpful. Symptoms: sense of spinning, which is called vertigo in medical area, with or without moving your body. Unsteadiness or off balance. Lightheadedness, motion sickness, which visual and body movements make you feel sick. I'll explain the details in the following talk. There are many causes of dizziness. We, physical therapists, can help BPPV, benign paroxysmal positional vertigo, which is spinning, uni and bilateral vestibular hypofunction, which you don't have enough inner ear function. Motion sickness, that you cannot tolerate visual and body movement stimulations. If you have dizziness from cerebrovascular accidents or tumor-related inner ear along those lines, which are called central types of dizziness, you have to go to the other specialist places. So we are going to check if you're a good candidate at the initial evaluation. Prognosis depends on what type of dizziness you have. For BPPV, prognosis will be excellent. For vestibular hypofunction, it was on one side, it would be good. However, if you had both sides problems, it would take time. For motion sickness, it depends on the severity of your symptom. When it comes to BPPV, this is a picture of inside your ear. These three circles are called semicircular canals, which are related to balance and eye movements. The dots inside the lowest canal are authorities, crystals. If they go into the canals, it changes lymphatic flow inside the canal. That being said, this abnormal sensation causes a problem with your eye movements because our inner ear is strictly related with eye movements. That's why if you got crystals inside your ear, you would feel spinning. How do we find out the problem? We hold the patient's head and quickly move the head into back. If you had crystals inside your semicircular canal, abnormal eye movements would be observed.
Another way of resolve like this: hold patient's head and look the patient's shoulder, and then have the patient grab my arms, and then please come down with me. Then check if the patient has nystagmus.
As this video shows, the therapist moves the patient's head with proper order. That being said, the crystal inside your inner ear would be eliminated. The good news is that the symptoms of BPPV is very harsh, but it has very good prognosis. I mean, you have higher chance to get excellent results from physical therapy.
And then put the hand like this, and then please come down towards me. Then check the patient's nystagmus. Then if the patient nystagmus fatigues, or wait for 30 seconds, turn her head towards light. Then don't bring up the head. After that, ask the patient, turn towards me. Keep the head flexed. And please breathe down your legs and then waking up. And keep the flexed position a little bit.
Let's move on to vestibular hypofunction, which causes dizziness without spinning, lightheadedness, and the off balance. Our eyes can fix on the target even you move your head because the picture shows inner ear adjust the eye movements. But if you don't have enough function of inner ear or ears, you cannot fix your eyes on the target and your vision becomes blurry. Then it causes dizziness and off balance. We are gonna check if you can fix your focus on the target when we shake your head quickly. If your eyes go off from a target, in this video my chin, it indicates inner ear hypofunction.
Head impulse test. Now we are checking the visual function by using manual technique. It's called the head impulse test. So first, you have to create a position almost same height as patient head, and then flex her head around 30 degrees. Because horizontal canal is going up 30 degrees, so make it horizontal and then shake the horizontally. That way, we can stimulate the horizontal canal well. Then please focus on my chin. Then relax the patient's head and move as quickly as possible. That way, we should check the patient's eyes are fixed on your chin or not. If the patient's eye move to the other way, cannot focus on the therapist's chin, in that case, it indicates that the
Simple. You try to fix your eyes on the target and shake your head to enhance your ability to fix your focus on the target. It makes your vision stable. Lastly, move on to motion sickness. Many people feel sick when you see the scenery from the train, and when you're on the train or in the car, you feel sick due to movements of the vehicles. The treatment would be similar to the hypofunction because you have to get used to the stimulation of vision and body movement. So this training is useful to get used to these stimulations since you are too sensitive to them. We are going to give you matched exercises depending on your symptoms. We would like to check and help you because many patients say dizziness is a very harsh and intolerable symptom. We are going to find out your problem. That being said, we can help you take a step into the right direction. Thank you.